Getting back to closing small hospitals and economics for a moment. Paradoxically, since this is meant to be an economics forum, and I'm not an economist, but just to give it a stab, closing smaller hospitals will actually adversely affect the economy of those communities, of those areas. Health policy is actually working against economic policy. As Ray said, there is no fit, there is no join-up. Take Mallow, for example. Mallow was designated as a hub for the Southwest under the National Spatial Strategy. Remember? And what's going to happen now? Mallow is going to lose its hospital. That's what's going to happen. So its future as a hub must be uncertain. Now, I shouldn't have said is going to lose its hospital, because that depends on us. That really depends on us. Ultimately, there is such a thing as people power, and we shouldn't forget it. Now, just to close, medicine has become careerist and elitist in this country. I think we need a new vision, and Ray has spoken a lot about visions today, and I would echo that in relation to health. We need a new vision of what medicine is for, a vision that incorporates patients and communities. We need to remind ourselves that hospitals are for curing the sick, for comforting the afflicted, if you like, not for company R&D, which is what they're being turned into. Doctors, some doctors, need to rediscover what Ray talked about, a leadership of service to the person. Ireland has never really succeeded in developing a proper public health service, not since 1953, when hospital beds were first gifted to medical consultants for their private practice. But there is still time, and that's what I want to say to you. There is still time. It's never too late. It's never too late to start. And now more than ever, we're going to need a public health system. We need to inform ourselves, to pierce the spin, to ask cui bono, who profits? And every time you read a press release in the Irish Times from the HSE, you should ask yourself that question. You should say, what's going on here between the lines? Who gains from this? We need to demand more, much more, of our elected representatives and our journalists as well, to take action, to oppose the cuts, to expose the privatisation agenda, to identify the vested interests, to vote in a way that reflects the new Ireland, to demand a decent public health service.